It's coming.
Okay. Okay, here my disclose about this talk, and I like to say, when did the out begin? It's in 2016 when I saw the Shin Yaman technique, and when he presented the flange technique, and then I had the idea how you told get a simple haptic, polypropylene haptic, and to fixate it in a simple CTS. And for the first time, I published the double flange polypropylene suture. Then I received award in ASCIS 2017 and published it in the ophthalmology university. Then I had the idea in late of 2017, why not to get a simple ProLens suture and enlarge the suture. And then I create for the first time the double flange suture with a simple 5060 polypropylene suture. And then in 2018, I published it in ASCIS meeting using a polypropylene suture to create the double flange for the first time in a patient with Marfan syndrome. And I published it in JCRS. Then late of 2018, I had the idea, why not to use this double flanged suture to fixate scleral IOLs? And then I create the 4-flange technique. The idea of the 4-flange technique was using a simple 26 gauge needle and a 50 ProLens suture. And I use, as you can see, a simple scleral fixation, PMMA no foldable, and I repeat this movement in the other side of the eye, and I do the first and the second flange in the eyelet of the IOL. And it's important, this moment, it's important to insert this IOL in the sulcus to avoid tilt. And you can set the IOL in the sulcus, and now you had adjustable suture with a 50 polypropylene suture, and you cut the first side and do the third flange and repeat it and do the 4th flange. And it's important to create a tunnel, insert it inside the tunnel to avoid conjunctival erosion and endophthalmite. And then many surgeons start to ask me, Dr. Canabrava, it's possible to do it with a foldable IOL? And then during 2019, I did a lot of tests using a sensor, using a techniques, and using how you can see in this. One moment, and using IOL punch, but any of this test was stable. Then after I start the idea to use a 4 eyelets IOL. In Brazil, you have Acrylic IOL, is acrylic hydrophilic acrylic IOL. You don't have a acrylic hydrophobic in Brazil. And then after my research, here the 4 flanged with a foldable IOL. It's like a 4-point fixation in the sclera. You need to pass the polypropylene suture in the eyelets of the IOL, like this, and you back the third point to the sclera, about 2.5 millimeter, and you insert the IOL in a incision with 3.5 millimeters with a burrata forceps, and only with the IOL inside the eye, we will back with the 4 point to fixate the first, second, third, and the 4th point. And observe, you cut first, as you can see now, the down flanges, and then you can adjust the IOL with the up polypropylene, and then you do the 3rd and the 4th flange inside the eye. Okay, here you have a lot of IOLs around the world that you can that you can perform the 4th flange technique. Some of these IOL, like Physio, like Arts from crystal lens, you can, it's in acrylic hydrophobic acrylic that is better than acrylic hydrophilic. At the end, no. Only in 2019, more than five surgeons published the double flanged polypropylene suture to create new techniques. Because this, I think this double flanged technique open a lot of ideas for different surgeons. It make the game in challenge case. For example, this case is from Dr. Kashikian from Los Angeles. Dr. Kashikian did a fourth flange technique, but he was the first guy that used the double flanged suture to fixate iris, artificial iris. But I suggest for him to do it only with 4 points, because you can paces the polypropylene suture in the iris artificial iris and together with the aqueous IOL. Now, my research, I have about 34 months when I have 21 eyes with subluxated cataract, microspheraphasia, trauma, Marfan syndrome, 17 eyes with single piece PMA IOL, and 8 eyes with foldable IOL. I stopped it 4 months ago because the COVID, no surgeries now. But as I can see, it's a new technique and you need more follow-ups to say. For example, one thing you can see in this point, it was one of my first surgeries that I did a big flanged, and I have inflammation in this flanged. I need to back to the operating room. First, I use a moxifloxacin for 7 days. After moxifloxacin for 7 days, I back to the operating room and I did a small flanged, and you can see in the right image how I solved this problem. Then my hints, my tips for who start the fourth flange technique. Number 1, do a large tunnel, like in Yaman technique. Don't do a small tunnel. In my beginnings, my first videos, when I started 3 years ago, I was doing a small tunnel because I was in the learn curve. And don't do a big flange. Do a small flange, it will be safe in the tunnel. If you do a large flange, you can happen like this one, you can back for the operation room. Okay? Let me see. As I told you before, some publication about opacification with aqueous IOL, because this I suggest, if in your country you have artists or you have any IOL with acrylic hydrophobic, I think it's better. Here, my last prize in AACIS this year, 2020, this year, that new IOL that I'm developed with a moisture from German. If you want to see the video about this new IOL, you can go to the SCIL Film Festival to see this video. Here, my Instagram, I publish every week one case about my hospital that I performed, and doubts. I'm here again. It was a pleasure to be here with EYETODAY.